So, good afternoon, everyone. Welcome. I'm sure a few more people will be kind of filtering in, but thank you for taking the time to join us for the PA 504 Continuum of Care FY 2026 Local Grant Competition Information Session. So you are here because you're either a current CoC funded provider considering a renewal application, or you're an organization exploring this opportunity for the first time. We appreciate your interest in helping Montgomery County address homelessness and housing instability. For those that don't know me, my name is Kaylee Silver. I serve as the administrator of Montgomery County's Office of Housing and Community Development, which acts as the collaborative applicant for the PA 504 Continuum of Care, which we locally brand the Your Way Home Partnership. Through the Your Way Home Partnership, we work alongside nonprofits such as yourself, housing providers, government agencies, advocates, and community stakeholders to build a coordinated response to homelessness across Montgomery County. So today's session is intended to provide an overview of the FY 2026 HUD Continuum of Care Program competition. This is a federal notice of funding opportunity and how we locally implement that NOFO or competition process. As you likely know, the CoC competition is one of the main sources of funding in Montgomery County to support housing programs that serve people experiencing homelessness and help them exit homelessness. So today we'll discuss project priorities, eligibility requirements, timelines, and opportunities for both renewal and new project applicants. Most importantly, we are doing this to ensure that organizations have the information they need to make informed decisions about participating in this year's competition. Before we begin, I'd like to remind everyone that today's session is being recorded and this presentation will be made available to you. So with that, for a few more housekeeping and to kick us off, it's my pleasure to introduce Jason Alexander of Capacity for Change. Jason serves as the PA 504 Continuum of Care consultant and brings extensive expertise in HUD CoC programs, grant competitions, and system planning. He'll walk us through the FY 2026 competition requirements, local priorities, and our application process. So Jason, thank you for your partnership and leadership, and I'll turn it over to you.
Thank you, Kaylee. Welcome, everyone. I'd like to ask you to use the chat for this afternoon session for two things. One is to please introduce yourself by name and organization or affiliation. And then please use the chat as we move through the presentation to pose any questions. We will take questions after the presentation. We'll prioritize first new project related questions and then renewal project related questions. And again, as Kaylee said, the materials will be made available after today's session. We welcome any questions you have. We reserve the right to not be able to answer all of them. Some of them, as we start to talk about the NOFO itself, we will identify certain priorities, certain aspects of the NOFO that we are awaiting further guidance from HUD to be able to provide informed answers. So if we cannot answer your question, that we'll let you know why. And we'll also be sharing ways that you can contact HUD directly with questions about the competition and how to apply using the HUD eSnaps grant data system. So these are the main agenda items for today. First, we're going to start with an overview of the Continuum of Care program. For those of you that are not familiar with it, then we will move into highlighting some key aspects and some major changes in this year's FY 2026 grant competition or notice of funding opportunity. And then we will share some specific priorities and guidelines related to our local PA 504 Montgomery County competition. So, what is the Continuum of Care program? The Continuum of Care program was created through the McKinney-Vento Homeless Assistance Act. So, it is created and authorized through an act of Congress, further codified and refined in the Federal Hearth Act, and it's administered by the United States Department of Housing and Urban Development, or HUD. The goals of the Continuum of Care program, more than anything, primarily it's to promote a community-wide commitment to the goal of ending homelessness. For our Continuum of Care, our community matches the boundaries of Montgomery County. Not every community in Pennsylvania is part of a county-based Continuum of Care. Many counties in Pennsylvania and around the nation are actually parts of multi-county continuums of care that share the same court entry system, share the same set of annual HUD grants. But we are fortunate in being a single county continuum of care that we can better align our other local resources, policies, and partnerships with what we are able to fund through the Continuum of Care grant program. The program does provide funding for a variety of organizations, and we'll go into more detail later about what exactly makes an organization eligible to apply. It's primarily nonprofit organizations, Indian tribes, or tribally designated housing entities and local governments. But we will go into more detail on exactly what organizations are eligible to apply this year. And the other goals of the Continuum of Care program are to promote access to and effective utilization of programs, particularly public resources, and optimize self-sufficiency among homeless individuals and families. We will highlight later in the presentation that per this year's NOFO, HUD has revised its definition of what self-sufficiency means. So that is a lens through which HUD is going to evaluate all grant applications for this competition. What the Hearth Act also does is codify four definitions of homelessness, and these definitions are used by HUD to determine who is eligible in a community for different HUD grant funded programs. So what's really important about these definitions is that they contain limitations that do not necessarily fit with our community-based definitions of experiencing homelessness, or frankly, there are other federal laws that define homelessness in different ways than these four categories, particularly a definition used by our pre-K through 12 education system. And so there can be some challenges related to referring people to programs that are restricted to one or more of these categories. And that does cause some tension in communities around the country between what locally we consider experiencing homelessness versus what the Hearth Act and HUD define as experiencing homelessness. The Continuum of Care grant program traditionally has been focused on meeting the needs of households that are part of the Category 1 literally homeless definition, which essentially means having a primary nighttime residence that is a public or private place not meant for human habitation, including the streets, abandoned buildings, other places that can't support safely human habitation, or people that are living in a publicly or privately operated shelter to provide temporary living arrangements. And then the final category one component are people that are exiting an institution. Often that's a jail or a hospital. And they've resided in that institution for 90 days or less, and they were literally homeless before they entered that institution. There are a number of record-keeping requirements that people have to use and housing providers have to use to really document whether people are eligible for these definitions. But the main takeaway is that category one, literally homeless, and category four, people fleeing or attempting to flee domestic violence, sexual assault, dating violence, stalking, and human trafficking. For at least the last decade, almost exclusively continuum of care funded programs can only enroll people that meet the category one or four definitions. As we'll see in this year's competition, there is some possibility of serving category two households. Those are households that are at imminent risk of losing their nighttime residence and meet the other criteria in that definition. However, we are not able to support projects, apply for projects that use the category three homeless under other federal statutes. And that refers back to what I was saying a few minutes ago about the fact that there are other federal definitions of homelessness. Most continuums of care around the country, not all, are not able to serve category three households in their projects, and that does apply to the PA 504 continuum of care. Another key definition that's part of the Continuum of Care program is what is called chronic homelessness. Chronically homeless individuals or families are designated as such by meeting these criteria, which is also codified in federal law. And that is an individual, it's a household that includes an individual with a disability defined in the McKinney-Vento Act and meets other criteria, primarily which is having been homeless and living in a place not meant for human habitation for at least 12 months or at least four separate occasions in the last 3 years that equal at least 12 months. There are some other clarifying aspects of this definition. The reason it's important is that one of the traditionally primary project types funded through the Continuum of Care program is permanent supportive housing, and many permanent supportive housing programs prioritize chronically homeless households. So, in many continuums of care around the country, it is primarily chronically homeless households that are currently residing in those programs. And there are some changes in this year's competition that could potentially alter whether that is a priority for PSH or permanent supportive housing projects. So we will also be talking about that in the FY26 NOFO highlights. There are basically six major categories of projects that can be funded through the Continuum of Care program. This is as is defined by the program itself. Not all of these project types are eligible in each year's annual grant competition. That is determined by HUD on an annual basis. And many COCs are not eligible to apply for projects in one of the categories, and I'll be showing you that as well. One of the major components that can be funded through the Continuum of Care program is the permanent housing component, and that takes two forms. Permanent supportive housing is a longer term leasing or rental assistance project. Leasing meaning that it's actually the provider, the recipient of the grant that is leasing units in its name and then subleasing those units to the participants in the program. Or it's a rental assistance program in which the participant has the lease in their name and the grant recipient or provider is subsidizing that rent. It provides supportive services, and to qualify for permanent supportive housing, at least one member of the household must have a disability. And for projects that have what HUD calls a dedicated plus project type, it must prioritize people that are chronically homeless upon entry. PSH tends to be a project for individuals and occasionally families in which the disabling condition is a significant and long-term barrier to self-sufficiency and requires often very long-term supportive housing and intensive case management and wraparound services. It is a very expensive project to deliver, but it can be a very effective project for people that need it and households that need it. There is another form of permanent housing, which is called rapid rehousing. This provides up to 24 months of tenant-based rental assistance and supportive services to households experiencing homelessness. Typically in the past, category one or four, that remains true in this year's competition. And that provides essentially a shorter term intervention for households to regain their self-sufficiency. The second major component of the Continuum of Care program is transitional housing. Transitional housing has many definitions, but the technical HUD definition is temporary housing with supportive services to individuals and families experiencing homelessness, with the goal of them successfully moving to and maintaining permanent housing stability. What makes transitional housing different from permanent housing is that while it can cover, like rapid rehousing, it can provide a rent subsidy and case management for up to 24 months. It's different because participants in the project do not necessarily have to be the tenants. They don't have to have a signed lease. They could have a sublease, meaning that, like permanent supportive housing, transitional housing can be master leased by the provider or grant recipient, or it means that the tenant or the participant can simply have an occupancy agreement if the provider of the service owns property, for example, and is using that property to provide temporary housing up to 24 months with supportive services to the participants. That project component has not been funded in the annual grant competition for over 10 years, but it is a not only eligible project type in this FY 2026 NOFO, as you will see, it is actually one of HUD's highest priority project components for this year's competition. Then there is a subcategory which really merges transitional housing and rapid rehousing into one project. That means that households can begin their enrollment in a temporary housing situation as they find and move into rapid rehousing, permanent housing in the community. We do have transitional and rapid rehousing joint projects in our continuum of care. For this year's competition, just so you know in advance, HUD will not be accepting any new project applications for joint TH and RRH, but existing projects of that kind are eligible to apply for a renewal of their current grant. There is another significant component that is eligible in the Continuum of Care program called supportive services only. These projects cannot provide any housing directly or housing supports to their participants, but they can provide other necessary services to households meeting some of the definitions of homelessness, some of the HUD category definitions. So these projects may only assist participants for whom the grant recipient or subrecipient is not providing housing or housing assistance directly to the participants through this program. One of the most common SSO project types that has powered continuum of care locally throughout the country for several years is coordinated entry. That is a standardized, centralized process of understanding, identifying the needs of people experiencing or at risk of homelessness, and then providing a uniform, coordinated way for them to access the system, be assessed for and prioritized for various housing and supportive services, and be referred and connected to those housing and supportive services. Core entry is required by HUD, and so it is a high priority SSO project type in the grant competition. There are two other project types within this component. One is street outreach, and the other are standalone projects, which provide things besides housing or street level engagement. And those standalone projects, there's actually a significant range of options of what those projects could provide. Everything from utility deposits to mental health and substance use treatment services to other case management related services. But again, for an SSO standalone project, it can provide those things to people meeting some of the HUD categories of homelessness, but it cannot also be their housing case manager. So it's really a complement to the housing projects that are funded through the continuum of care. What's really important is that street outreach and standalone projects have not been an eligible project type for several years in the annual NOFO grant competition. They are both eligible this year, and just like transitional housing, they are a high priority new project type for HUD in this year's competition. The last two components that are eligible under the Continuum of Care program, the first is Homeless Management Information System, or HMIS. This is a HUD required confidential, secure data system that all CoC grantees except for VAWA Act funded providers, typically victim service providers, are required to enter program and client level data in and use it for required HUD reporting purposes, and also for the CoC to use for overall CoC system planning and evaluation. HMIS is being operated here in the PA 504 CoC. It's being operated by the Montgomery County Department of Health and Human Services, and it is essential to functioning. But only the department, as the HMIS lead entity, can operate the HMIS and apply for those HMIS grants. The last component is homelessness prevention. Homelessness prevention provides short and medium term rental assistance and stabilization services for people that meet the Category 2 imminent risk or at risk definitions of homelessness. But we are not, like many COCs around the country, eligible to apply for homelessness prevention projects because we have not been designated by HUD as a high performing community. That does not mean we don't have a high performing crisis response system. That's a technical designation with certain criteria HUD has, and there are very few of those designations authorized nationwide. So, to be very clear, we cannot accept or request funding for any homelessness prevention projects through this grant competition. Who can apply for a continuum of care program grant? Essentially, any nonprofit 501(c)(3) organization whose status is active with the IRS, as well as units of state and local government, public and state institutions of higher education, Native American tribal governments and tribal organizations, public housing authorities and Indian housing authorities, any faith-based organization that meets these same criteria. Who is not eligible to apply for a continuum of care grant are individuals and for-profit entities. If a 501(c)(3) is applying for a continuum of care grant, they must have a federal unique entity identifier or UEI, and that can be that registration is accessible through a federal government website called sam.gov, sam.gov. If your organization intends to apply for a project grant through this competition, you must have the UEI before the competition deadline. How does HUD determine the funding available at the local level for the Continuum of Care grant program? We cannot, and no COC can just apply for as much funding as it needs to meet the needs in the community. It must apply for a fixed amount of funding that is designated by HUD, and that's based on a fairly complex formula related to each COC's population size, poverty rate. That's why larger continuums of care that include multiple counties might have significantly higher annual grants to compete for because of that formula. And then the next part of the formula has to do with how much funding is currently going into every local COC like Montgomery County for projects that are continuum of care funded and already operating with participants enrolled in them. And then every year, in addition to a fixed amount of funding to renew those existing projects, potentially, there is always a fixed amount of new bonus project funding based on HUD formula that can be competed and applied for at the local level. And we'll talk about a little bit more about what those bonus projects are in the NOFO and in the local competition. So we are still waiting, as is the entire country, for HUD to announce exactly how much funding we can apply for, but we are going off of last year's competition as a starting point, and I'll share that starting point later in the presentation. So the takeaway here is that we have a limited amount of funding we can apply for, and there is no guarantee that HUD will give us all of that funding. That's their right to decide how much to award within the confines of what we can compete for. That leads us into the actual FY 2026 Notice of Funding Opportunity. The competition has begun, even though we don't have all of the information we need. Nationally, there is $4 billion available to fund continuum of care projects. There are some restrictions that HUD has placed on how that funding will be used. So there are restrictions for how much will be a minimum amount that will be allocated to what are called domestic violence bonus projects. That's one form of new project that is available to any or eligible organization that is committed to serving 100% DV survivors, people fleeing or survivors of domestic violence in that project. There is another at least $430 million set aside for permanent housing component projects for families with children. And the most significant carve out is up to 1.3 billion of that 4 billion set aside for new projects in something called Tier 2, which we'll explain, with a priority for transitional housing and supportive service only projects. So again, almost exclusively HUD is prioritizing for new projects the transitional housing component and the supportive service only component. The competition began June 1st. The competition deadline is August 26th. That is the date and time that we as the CoC need to submit our entire application package. That includes an overarching narrative application that is written by the collaborative applicant, in this case by the Office of Housing and Community Development within the department. And then HUD intends to announce the awards in December of this year. So just observe three things about these dates. One, it's a very short competition. We don't have a lot of time to manage the entire competition from start to finish. Second, there are some significant pieces of information that HUD has not released yet, including the amount we can apply for exactly, including detailed instructions on how to answer the application questions, and some other key details around what is in the NOFO itself to clarify exactly what they are asking for. So as we get those details, and then the last key pieces, they actually haven't opened up the project applications yet. So no one can even start writing applications because no one has seen them yet exactly. But regardless, the entire competition must be completed and applications submitted by August 26th at 5 o'clock p.m. Eastern Time. The other thing to take away from this is that when you're applying for a grant this year, if you are a new project, you should be thinking about a project being, if it's awarded by HUD, it would be awarded in December or perhaps January. And then there is a contracting process which will take a few months. So you're probably looking at a project start date of mid 2027, and then typically running on an annual renewal cycle. If you are a renewal project applicant and you're applying to continue operating an existing CoC project, for the most part, it will continue to run off of your contract year. So HUD contracts directly with each of its grant awardees, and the exact start date and end date of its annual contract depends on the negotiation and the administrative process with that individual grantee. But they would also be projects, if awarded in 2026, would renew at some point in 2027. What are HUD's priorities for this year's NOFO? This is a significant shift in priorities from previous years. HUD is really prioritizing improving outcomes that promote self-sufficiency, particularly through employment and earned income, as well as recovery from substance use disorder. Second, creating more competitiveness, and basically you'll see as we look through the scoring of this year's competition, it is much more competitive, not only to receive awards within one CoC, but we will show you how every CoC is actually competing with each other for 40% of the total funds it can apply for. Restoring balance to the continuum of care reflects the new focus on transitional housing and supportive services only, a shift away from a housing first approach, prioritizing treatment and recovery, which we will have to demonstrate as a continuum of care and through our project applications that we have meaningful partnerships with behavioral health, providers that we are providing CoC program participants with mental health and substance use treatment services and other wraparound services with the goal of achieving economic self-sufficiency, advancing public safety for all. We are also going to be required to document how we collaborate with law enforcement and other criminal justice system and community partners. HUD continues to prioritize minimizing trauma for vulnerable populations, excuse me, which means promoting trauma-informed and person-centered care, especially for survivors of violence. And finally, HUD is prioritizing expanding access based on merit. And it's just promoting and requiring us to do what we've always done, which is to encourage any and all eligible applicants to submit applications for projects that meet the HUD guidelines, the NOFO criteria, and that will help us better end homelessness in Montgomery County. There are some significant changes to this year's NOFO that make the competition, as was just outlined, more competitive. One of the greatest challenges is that there are two tiers of funding in the Continuum of Care annual grant competition. Tier one we generally think of as if the local continuum of care is telling HUD that this is a high priority project and it meets HUD's minimum threshold criteria for fundable projects, that project is likely to get funded. So tier one is a much safer category of funding. It ensures continuity of programming year to year and meeting local needs year to year. In previous competitions for several years, 90% of the total grant request that we apply for could go in tier one, and that means 90% of the funding that we're competing for is pretty fairly guaranteed. There's a second tier called tier two. Typically, COCs put into tier two lower performing renewal projects and any new bonus projects that it can apply for. Tier two projects are not guaranteed funding. It's HUD's discretion as to whether to fund those. And projects in tier two traditionally are competing with every other tier two project submitted by every other continuum of care around the country. This competition, tier two, is moving from 10% to 40%. So that will have implications on our system because the majority of funding available typically is for renewal projects. And in this case, every continuum of care will be forced to put some of its current renewal projects, even though with full enrollments, into tier two and risk losing those projects in the competition. This year, COCs could put any project in tier one or two, any new project, any renewal project. And also, for the first time, COCs can reallocate first year renewal projects. So even projects that have only just gotten started, but technically, potentially could be moved into tier two, reallocated, or even eliminated. Second major change is that by reintroducing transitional housing as an eligible project component, HUD is assigning to that all new transitional housing projects are required to deliver mandatory supportive services to all of its participants in that project. And that means 20 hours a week of supportive services with the following exceptions. Participants that are age 62 or older are exempt. Participants that have, and this is a HUD term that's replaced disabling condition for this purpose, a handicap, which does have a federal definition, or a developmental disability. So those are the exceptions to required supportive services. The other set of exceptions being if the participant is working or providing a community service similar to the new Medicaid work requirements. So we believe it'll be a similar definition of what's considered community service as in the Medicaid regulations that were just issued. But otherwise, participants have to have 20 hours a week of mandatory services. That means transitional housing project applicants have to think about, as part of their budget, having either the staffing or the partnerships to deliver those 20 hours of services. The NOFO and additional guidance we're hoping to receive soon from HUD goes into greater detail around what those supportive services could include. They definitely include case management, but there is also a HUD priority around supportive services that increase employment and earned income. And so that more details of that can be read in the NOFO. The new street outreach projects that are eligible to apply in this year's competition do have a HUD priority focus, and that priority focus is reducing unsheltered homelessness, including encampments in partnership with law enforcement. So, new street outreach project applications will have to demonstrate how they will do that effectively in order to be competitive for HUD. The new standalone projects that focus on self-sufficiency have to meet the new HUD revised definition of self-sufficiency as the ability to meet basic needs, including a place to live, without public or private assistance. That ties back to one of HUD's new priorities being that people should be moved to self-sufficiency as quickly as possible. And finally, there are priorities within the NOFO competition for projects, whether they're new or renewal housing projects that deliver on-site treatment services. What exactly is meant by on-site is a question that many of us are asking for clarification on, and HUD has not yet issued significant amount of clarification on what that means, particularly for housing projects that are scattered site in which participants are not living in the same location. What does that mean? So we're still trying to figure that out, but projects that can demonstrate some level of on-site treatment services, particularly substance use recovery services, is what we're talking about, will be more competitive to HUD. The last major key change to highlight is that there are more rigorous scoring criteria for every local continuum of care and every local project application to be competitive for funding from HUD. And the vast majority of the points that are available are for our entire local CoC to demonstrate meaningful partnerships with other community-based organizations and the coordination and engagement that goes with that. And then there are some other scoring factors, including, as is often the case, system performance. But that's really where the heart of it is. And if you read the NOFO, you will see how those merit scoring criteria are mapped out and what HUD is expecting CoCs to do locally to get those points. It's much more competitive than in previous years. So for this year's NOFO, if you are a project applicant or a potential project applicant, there are two types of applications that can be submitted in any local competition for HUD consideration. One major project type are new projects. These are projects that are not currently Continuum of Care funded. That does not mean they have to be new projects, period. Just that they are new projects in the Continuum of Care program. These projects may be funded through the following grant sources within the competition. One is that they are funded through the new bonus project award amount that we're awaiting. So there'll be a fixed amount of funding we can compete for new projects that meet HUD priorities and eligibility criteria, regardless of who they serve. But there are scoring points for serving priority populations. There is also going to be a separate set of new funding available to us for new projects that serve domestic violence survivors exclusively. And an eligible organization does not have to be a VAWA-funded victim service provider to apply for DV-only bonus project funds, but it must be committed to serving DV survivors exclusively if that project is funded, and demonstrate that it can do so in a way that is trauma-informed and really person-centered for those survivors, so that the project's demonstrating that it has the capacity to work with survivors and their needs. The third way that a new project that is applied for could be funded is through what's called the reallocation of existing renewal projects. HUD emphasizes the need for local communities to reduce or eliminate the grants to projects that are either underperforming in terms of system performance or that are underutilized in terms of bed capacity and the grant funding itself. So renewal projects that are low performing and or are not spending, their funding in every year on time and completely are projects that need to be reallocated. So as part of this year's competition, the CoC will look at current renewal projects and determine if any should be reallocated. If those projects are either reduced in size or eliminated completely, any funding that was going to them can be added to the pool of funds for new projects. The last way to create new projects in this year's competition is only available to renewal grantees, and those are called transition grants. And in a transition grant, it's technically a new project application because it's transforming a renewal project that already exists into a different project type. So it's shifting from one project component to another. HUD is really emphasizing the shift from rapid rehousing and permanent supportive housing renewal projects to new transitional housing projects. That's really the HUD priority. When that happens, if a renewal project applicant applies for a transition grant and is awarded by HUD, first of all, it must be the same recipient. It can't be handed off to another organization. Second, as far as we understand, that renewal applicant must apply to transition the entire grant amount. So it's not a partial transition, it's a complete transition. And then, if awarded, the project will continue under the new project type when their current annual contract expires. And then the organization will have 1 year to make that transition effective. The good news about that 1 year transition is that means that current participants do not need to exit the program the day it becomes a transition grant. There is a 12-month period where that can happen, but just to be aware, there will be some current participants in those projects that will not be eligible to stay in the project if it transitions from permanent housing to transitional housing. So, as an applicant, once we can publish the exact amount of funding we can use for new projects, for the applicant, it doesn't matter what the source is except for the DV only bonus project or the transition grant project, because otherwise you're applying and then the CoC is deciding which of these types it will use to fund that project. The other type of project application that will be accepted in the FY26 NOFO are the renewal of current projects, but they are again subject to reallocation. Renewal projects may also choose voluntarily to reallocate if, for example, they've identified a pattern of underspending or underutilization, or they recognize that the project is no longer meeting the needs of the community or is no longer high performing. In this year's 26 NOFO, these are the following eligible project types. I've already referenced them, so this is more of a summary, but I do want to point out a couple of key nuances in terms of what can be applied for. So for permanent housing, again, permanent supportive housing is eligible. Um, what's new in FY 2026 is that previously PSH projects that were not already dedicated to serving chronically homeless households or designated as dedicated plus may now serve people with disabilities who meet the category 2 imminent risk of homelessness definition. That's something to be determined by the applicant, but that is now eligible in this year's competition. Rapid rehousing remains an eligible project component. Joint THRH can only be a renewal project. It cannot be a new project application. Transitional housing is the new project type that's a priority for HUD, including new DV only transitional housing projects. But please note, and here is one of the major challenges to nonprofits applying for the transitional housing component. By federal statute, 501c3 nonprofit organizations are not allowed to distribute rent assistance through a transitional housing project grant, nor can a transitional housing project in which the applicant owns or leases the building can pay for leasing costs for themselves. So if an organization applies for transitional housing for a project in which they own the units, they cannot apply for leasing funds to basically pay themselves for the leasing costs because that is defined in the statute as a conflict of interest. This is a significant challenge because what the federal statute requires is that rental assistance for a transitional housing project may only be administered by a local housing authority or a local unit of government. So, organizations that intend to apply for a transitional housing project as 501c3 nonprofits must do one of two things. For in terms of if it's a rent assistance project, they must have a subrecipient that can cut the rent assistance checks to the landlords. That's not them, and that could only be a local housing authority or a unit of local government, county or municipal or state. If they are a transitional housing project applicant and they own the property and they intend to sublease or have an occupancy agreement with their participants, this project can pay for a significant number of costs, including operating costs, administrative costs, HMIS data entry costs, staffing and supportive services. However, it can't be used for rent assistance unless or leasing costs. The only exception to that is that a transitional housing project that owns the units and charges rent to its participants could have a authorized subrecipient that is either a housing authority or a unit of government that is providing the rent assistance directly to the tenants. So those are really fine exceptions. So this is a significant barrier for nonprofits that are applying for transitional housing. The application to be competitive must include a subrecipient that can distribute the rent assistance, or rent and lease costs cannot be involved in the project application. The third major project component eligible, all three of the major supportive service only projects. Homeless Management Information System is restricted to the HMIS lead agency, and homelessness prevention is not eligible in most communities, including Montgomery County. How then is HUD going to decide which of these new projects to fund? The NOFO contains extremely detailed scoring criteria. So even if we locally submit a new project for any of these project types, HUD is still going to evaluate and score and decide whether or not to award that project based on these objective criteria. And this is just a summary of those criteria. So note again that transitional housing projects will be more competitive if an organization can demonstrate that is already operating a transitional housing project and has some successes related to exiting to permanent housing within 24 months and increasing employment-based income for at least 50% of participants. Again, transitional housing projects will also have to demonstrate that they are delivering at least 20 hours a week of required services, activities, or employment, with the exceptions noted to every participant. The standalone SSO projects, again, are restricted to serving sheltered and unsheltered persons to increase their self-sufficiency, but cannot provide any housing-related costs or case management. Street outreach projects need to prioritize working with first responders and law enforcement, and helping to support the elimination of encampments. And then the other project types have other criteria. And again, I refer you to the NOFO for those details. The last real key thing to know about this competition is how then is HUD going to decide which projects to fund in both the tier one 60% and the tier two much more competitive 40%. And this is a flow chart from the National Alliance to End Homelessness that really summarizes that well. HUD is going to take every CoC combined application, all of its projects, and it's going to walk through those projects in this order. And it's going to do it nationally all at the same time. So the first thing it's going to do is fund CoC planning costs. Planning grants are non-competitive grants that every CoC receives every year in order to really manage the entire system. That's a small percentage of the total $4 billion. It will then look at tier one projects that meet project threshold requirements. So this is why it's so important that any projects that are put in tier one are a little more secure in terms of funding, and they can be any type of project, new or renewal, including DV bonus. But projects in tier one that help a local CoC be more competitive to match the NOFO scoring priorities, those are the projects that every CoC is really going to have to prioritize putting in tier one. HUD will then look at all of the DV bonus projects across the country in tier one, and if it meets that tier one threshold of 104 million, it will then have the right whether to fund any DV bonus projects that are in tier two. If it doesn't award at least 104 million to DV bonus projects in tier one, it will automatically have to keep funding decide which projects in tier two to fund that are DV bonus. The next priority it's going to look at, HUD is going to look at permanent housing projects in tier one that serve families with children. And again, as soon as it has awarded up to 400, at least 430 million in those projects, it can keep going to its next conditional criteria. Otherwise, it will have to move into tier two and finish that set aside of 430 million in terms of selecting new projects or selecting renewal projects in tier two. Then it's going to move into tier two. And in tier two, recall that $1.3 billion carve out is only for new transitional housing and supportive service only projects. So that is HUD's highest priority for tier two projects, transitional housing, supportive service only. According to national analysis, including the National Alliance to End Homelessness, there is not a lot of funding left in Tier 2 once all of these other conditional selection criteria are met, beyond funding new TH and SSO projects, meaning then HUD is going to look at any other types of new projects ranked in Tier 2 that could be homelessness prevention only for those high performing communities. It could be new rapid rehousing or new permanent supportive housing. But that's once it's funded as many transitional housing and supportive service only projects that it chooses to or wants to and meets that $1.3 million carve out at least, only then will it consider other new projects. And only then, at the very end, will HUD consider funding renewal projects ranked in Tier 2. The major takeaways from this chart are one, what CoCs need to do is really prioritize new transitional housing and supportive service only projects in terms of new projects. And the second major takeaway is that if a provider of a renewal project has that project ranked in tier two, it really needs to be prepared for that project to be eliminated in the HUD award process. So any renewal project in tier two is at significant risk of being completely eliminated in this year's competition. But at the same time, because tier one is only restricted now to 60%, it's impossible for nearly every CoC to put all of its renewal projects in tier one. And so there will be reductions in renewal project funding, even for projects that have participants enrolled in them this year. The other thing to note, if you're applying for a new or renewal project, is to carefully review the threshold criteria that are in the NOFO. These are criteria that apply to all projects. There are some additional threshold requirements related to new projects, and so again, the NOFO is the best guide for creating and submitting a competitive application. But we are required as local COCs to review all project applications received according to these threshold criteria, and any project applications that don't meet all of these threshold criteria are automatically rejected and will not be scored or considered. Um, Note that there are two new threshold requirements in this competition. Uh, According to HUD, the first is the project applicant will not engage in illegal racial discrimination. And second, the project applicant will not operate drug injection sites or safe consumption sites. So it's really important to understand all of these threshold criteria before submitting an application. That leads to our PA 504 Montgomery County local competition guidelines. We've set these guidelines as best we can while awaiting further instruction and information from HUD. The PA 504 Continuum of Care does serve all of Montgomery County, Pennsylvania. The Department of Health and Human Service, Office of Housing and Community Development is what's called the collaborative applicant. The collaborative applicant is responsible for submitting the entire grant application, including a very detailed narrative around how the entire homeless crisis response system works, and then a justification of why the projects that are being recommended for funding will help improve that system and in terms of outcomes. In the last significant competition, FY24, HUD awarded the PA 504 CoC about $5 million. So there is about $5 million of funding powering this part of our crisis response system. And that's what we anticipate having about the same amount for this year's competition once HUD releases those final dollar amounts. The 5 million in FY24 funded primarily permanent supportive housing, rapid rehousing, some joint transitional housing, rapid rehousing, our required HMIS, and our required non-competitive planning grant. The PA 504 CoC is soliciting both new and renewal projects from all eligible applicants that meet the HUD FY 2026 NOFO guidelines and requirements. And as soon as we know the exact amount of new project funding, new DV bonus project funding, and reallocation funding, we will certainly be posting those details. But if you are a potential new project applicant, including a renewal project applicant that's considering a transition grant, please move forward with developing what those projects are, including who they would serve, what project component and type they would be, what their potential line item budget would be. As an important reminder, which I meant to mention earlier, all project applications must demonstrate upon submission that they can make a 25% required match using non-HUD fund, non-CoC funds. So part of a competitive application, and it was in the threshold requirements, is that there must be a demonstrated commitment of a 25% match to the amount being applied for from the Continuum of Care program, with one exception. Any leasing costs through permanent supportive housing, master leasing, or transitional housing leasing are exempt from requiring the match. So if an applicant can apply for a leasing project of those types, there is still a required match component, but the leasing line item is exempt from that 25% match. The CoC has a project review team. It's composed of non-conflicted governing board members. That team will be reviewing, scoring, determining whether to accept or reject, and then ranking in priority order all new and renewal project applications that are submitted and meet the threshold requirements, and ultimately will make their recommendations to the CoC governing board for approval. Little bit more information on what our local needs are in terms of uh, homelessness and unhoused individuals and families in our community to help organizations think about their new bonus projects or their new transition grants or renewal projects. And so some of this data includes that on the night of January 22nd, 2026, during the annual what's called the point in time count, um, in Montgomery County, we identified 477 individuals experiencing literal homelessness by the HUD Category 1 and 4 definitions. 59 of those individuals were unsheltered, living on the streets or another place not intended for human habitation. 418 were sheltered in a temporary location, primarily part of our emergency shelter and winter shelter or severe weather shelter network. Looking back at but that is just one night. So every community around the country does a late January one night snapshot point in time count, but that is not a reflection of how many families and individuals experience homelessness in Montgomery County year round. So, per the Your Way Home Montgomery County 2025 data analysis, the entire crisis response system provide services to a total of over 5,000 individuals, including offering temporary or shelter or housing, including providing rent assistance, case management, and landlord support that help 279 households and 1,108 individuals to secure housing, which was a 41% increase in households exiting homelessness compared to the previous year. So one of the major priorities for us and in the HUD Continuum of Care grant program is to increase the number of households exiting from the crisis response system into permanent housing with stability and self-sufficiency and remaining stably housed for a period of for forever, but as measured in 6 to 12 month increments. The Your Way Home Montgomery County Continuum of Care provided assistance to 139 veteran households, and through our core entry helpline, which is our SSO core entry project, assisted 16,000 callers who were seeking some sort of services related to experiencing or being at risk of homelessness. Not all of those calls were from people who meet those HUD category definitions, but that gives a broader sense of what the need is in the community. In terms of priority populations experiencing homelessness in Montgomery County, those priority populations, which many of whom have additional barriers to permanent housing stability and self-sufficiency, include DV survivors, seniors, reentry populations, people with physical and developmental disabilities, people in recovery from substance use disorder, and families with children. So, when an organization is applying for a new project, it's going to have the ability to identify in the project application what types of households will it serve. Many projects serve all. Other projects serve a smaller number, and these are populations listed here under priority populations where additional programs and services are needed. And new projects can apply to serve one or a few priority populations rather than the general population experiencing homelessness, particularly if it can demonstrate that it has the ability to meet the needs of that priority population with experience and with the additional service requirements that support successful exits to permanent housing and self-sufficiency. So this year, this competition, the CoC will accept new project applications, including transition grants for transitional housing projects, particularly those that serve priority populations, for new SSO street outreach projects, especially there's a need for street outreach to serve families with children, other SSO standalone projects that again contribute to the self-sufficiency of households experiencing homelessness without directly providing housing. And the only eligible new project types that are in the 26 NOFO, but that are not considered priorities in this continuum of care in Montgomery County are permanent housing projects, including PSH and rapid rehousing. So just to be clear, the PA 504 Continuum of Care Governing Board voted to accept new projects under the NOFO guidelines for transitional housing and street outreach and SSO standalone projects, but is not accepting new project applications for permanent supportive housing or rapid rehousing, and that is intended to best meet local system needs and also align with the funding criteria in the FY26 NOFO. So I mentioned that the project review team first will evaluate all eligible applications, determine which to accept, which to and what order to rank them in terms of tier one and tier two. The governing board will review and make the ultimate decision on that priority ranking, and the submission to HUD. But that in this year's competition, it's really important to emphasize that while every project will be scored using our CoC board approved scoring tools, the CoC is reserving the right to rank projects based on more than just their score, but also on how they help us strategically maximize the total amount of funding that we can secure from HUD through this grant competition in order to meet local needs. The timeline for the project, while the competition is open, again, we cannot fully begin the process till we have more access to HUD resources, but we will be posting the scoring tools, which include separate scorecards for new and renewal projects. Tomorrow is is our posting date. We are waiting for the applications to open in what is called the HUD eSNAP system. If you are an organization that intends to apply for a new grant for the first time, this CoC is only using the official HUD eSNAP's grant data system to accept all new and renewal project applications and required attachments. So we are waiting for HUD to open that portal like all of our peers around the country, and then we will accept applications through that portal directly. Tentatively, the applications are due in eSnaps once the competition opens in eSnaps July 16th. Because of certain required milestones in this competition that we must meet in order to secure our HUD scoring points, we have to have the project application submitted to us in eSnaps by July 16th. They're not going to HUD at that time. They're going just to the collaborative applicant here locally. That way we can review them. We can provide them to our project review team, and ultimately we will accept or reject and then rank them based on those eSnaps applications. We will be announcing publicly and directly notifying all project applicants by August 11th, 2026, of whether their new or renewal project was accepted, rejected, in terms of renewal projects only, reallocated, and then their final ranking in what's called our priority listing of projects. We will then be posting our final consolidated application and priority listing of all new and renewal projects for public review on August 24th online. And we have to submit our application on or before the August 26th deadline. This competition absolutely requires additional information, and that information is available to you in a variety of formats. Let me start by highlighting that the HUD Continuum of Care program and the HUD FY 2026 Continuum of Care program NOFO competition pages are an absolutely critical source of information for new and renewal project applicants. This is just a very high level summary of what we know about the NOFO, but the best source of information is the NOFO itself. If an applicant has questions about what's in the NOFO, what makes a project eligible, what makes a project competitive, what some of the terms mean in the NOFO itself that may not be clear. All of those questions should be directed to HUD by email to an account that is called cocnofo at hud.gov. Not every NOFO question submitted is responded to immediately, so there is some patience required, but that is the best way to get answers to applicant questions. The HUD eSNAP system is linked here. If your organization is not yet registered with eSNAPs, now is the time to do that. We don't have to wait for project applications to open, but you will want your organization to have an organizational profile and at least one user profile in order to complete project applications once they are open in eSNAPs. And if you have any problems or questions using eSNAPs, including registering, lost or forgotten passwords, updating information in eSNAPs, there is another dedicated HUD email address, and that is e-snaps at hud.gov. And then an additional page of information, HUD recently posted a 3-page memo clarifying which current program participants are eligible to move from a permanent supportive housing or rapid rehousing project into a transitional housing project created by a transition grant from the same organization. And that's really important guidance because unfortunately, there are very limited kinds of participants that can immediately transfer from one project type to another because unfortunately, as a product of being enrolled in PSH or RH, they no longer meet the HUD Category 1 definition of homelessness, which would enable them to go into transitional housing immediately. So that is definitely important to read, particularly for renewal project applicants that are submitting transition grant applications to transitional housing. For local information, we've linked to our local Continuum of Care webpage. That is a page we recommend you go to often, as when we have updates locally, including the exact amount of bonus project funding we have, and when the eSNAPS portal is open to accepting project applications, those updates will all appear on our local grant competition page. That is also where we will post our draft application for public review. Finally, if you have questions about the local competition, please email me directly as the CoC's consultant. That's my email address. Keep in mind, though, that if it's a question that is about the NOFO itself or about using eSNAPs, that it's much better to email those two HUD emails directly, because I most likely would suggest you do the same thing when I receive your question. But I will be responsible for sharing with the collaborative applicant, and together we will answer any questions about our local grant competition for this NOFO. Now we're going to move into project question answer, and I'm going to stop the recording and begin to answer questions first that are in the chat.